All right, let's jump right in. Today, we're talking about something huge that's happening in healthcare, the collision of artificial intelligence and nursing. And listen, this isn't some far-off sci-fi idea. It's happening right now, and it's pretty much set to change the entire game of patient care as we know it. But first, to really get this, we have to start with the reality on the ground for nurses today. And this quote, wow, it really nails it. We're talking about a state of constant crisis. This isn't just about being busy or having a tough day. It's a systemic pressure cooker. And that kind of pressure, well, it has a massive cost. Look at this number, 100,000. That's how many registered nurses have left the workforce in just the last 2 years. They're walking away because the stress and the burnout are just completely overwhelming. So that leads us to the big question, right? The real tension at the heart of all of this. In the face of a crisis this big, can something like AI be a lifeline? Can it actually help ease that burden, or is it a threat? Is it going to replace that essential human touch, the very thing that makes nursing, well, nursing? Before we can even get into the solutions, we really have to wrap our heads around the full scale of the problem. So let's take a quick look at what nurses are really up against day in and day out. And I mean, the sheer scale of this is just staggering. We're talking burnout like we've never seen before, patient-to-nurse ratios that are just impossible, and this mountain of paperwork and administrative tasks that pulls nurses away from their patients. And check out that last number. More than 600,000 nurses are saying they plan to leave by 2027. That's not a small leak in the system. That's a floodgate about to burst. So, with the problem laid out that clearly, you've got the tech world stepping in with this very powerful and, let's be honest, often hyped solution, AI. But what does that actually mean? What can AI really do for a nurse on the front lines? Okay, first up, let's talk about one of the biggest time sucks there is, documentation. Just imagine this. A nurse finishes up with a patient, and instead of spending the next 20 minutes typing, they just speak their notes out loud. An AI scribe listens, transcribes it, and puts it perfectly into the health record. That could give them back hours in their day, hours they could spend with patient. But it gets even cooler. AI can act like a crystal ball, an early warning system. You've got predictive models that can spot a potential staffing shortage 2 times days away, not just 2 hours. And even more amazing, they can analyze tiny changes in a patient's vitals, things a human might miss, to predict who's at risk of getting sicker. That's not just helpful, that's potentially life-saving. And get this, AI isn't just software, it can have a physical body too. We're talking about robots that can handle the repetitive, back-breaking work, like lifting patients or managing medical supplies. This frees up nurses to do the complex, critical thinking work that only a human can do. Okay, but all this amazing potential, all this automation, it brings us right back to that big fear we talked about. If a machine can do all of these things, what's left for the nurse? And maybe even more important, how much can we really trust it? And, this hesitation isn't just some vague fear of new tech. It is absolutely rooted in real, valid concerns. How do we know the data the AI learns from isn't biased against certain groups? Who's on the hook when it makes a mistake? These aren't minor details. They're huge ethical questions. And this, right here, is the absolute heart of it. AI is a beast when it comes to data. It can crunch billions of data points in a second, finding patterns we'd never see. But nurses have the superpowers of empathy, of critical judgment, of seeing the whole patient, and of fighting for them. And those are things you just can't code into a machine. Which brings us to a really crucial point. Any AI is only as good as the data it's fed. And a simple human error, especially in a hospital where everyone is stressed and overworked, can create a massive ripple effect with serious consequences. Let me tell you a story about how that can happen. So, meet Ava. She's a new nurse, she's totally exhausted, and she's trying to be efficient. So she uses that copy forward feature in a patient's electronic chart. But here's the problem. She accidentally copies a tiny error. A patient who smokes is now listed as a non-smoker. Then the next nurse copies it, and the next one. Years go by. Now all that flawed data gets fed into a brand new AI model. The AI is now fundamentally broken, miscalculating risks for patients, all because of one small mistake born from burnout. Ava's story is the perfect example of why we need to change the entire conversation. We need to stop talking about artificial intelligence replacing people, and we need to start talking about augmented intelligence supporting people. This idea is a total game changer.
Augmented intelligence sees AI as a powerful assistant. Its job is to do the heavy lifting with the data, to find the patterns, and to free up the nurse to use their human intelligence. The goal is to make nurses more human, not less.
This framework here shows how that partnership works perfectly. So AI is brilliant at the first two steps. It takes all the raw data, like a single blood pressure reading, and organizes it into useful information, like a trend over time. That then frees up the nurse to do what only they can: apply their clinical knowledge and, critically, their human wisdom. That's where empathy and judgment come in to make the best call for the actual person in front of them.
So, this huge transformation, it's not something that should just happen to nurses. This is a future that the nursing profession has to step up and actively shape to make sure these incredible tools are built right and used responsibly.
And leading that change means asking the hard questions. Nurses need to be the guardians of ethics right there at the bedside. They need to be asking, hey, is this AI tool transparent? Can I see how it works? Is it fair or is it biased? Who's responsible if this thing is wrong? And the most important question of all, is it safe for my patient? So, what's the actual game plan? Well, this roadmap gives us some really clear, doable steps. It's all about nurses taking the lead, pushing for education, creating strong ethical rules, and demanding a seat at the table when these powerful technologies are being designed and rolled out.
At the end of the day, this brings us right back to where we started, but with a totally new way of looking at it. The future isn't some battle, AI versus nurses. It's a partnership. So the real question isn't if technology is coming, it's already here. The question is, how will nurses step up and lead us into this incredible new era of care?